Can we hear
Hello.
Dr. Awasthi and then we'll come back to Mr. Satyanarayana?
Hello, good evening. First of all, thank you for allowing us to join this very important webinar, especially from all over the world. Everybody's here. I can see Ariel, Lee, Chandpalji, and our friends from all over the world. So, our greetings to all of you, and we wish you good health, and we wish you good health for you and your country and your people. COVID-19 is a challenge which has really shaken up the human population. As a cooperatives, our role becomes extremely important in this situation, especially IFFCO being a cooperative which is owned by the farmers, and India being basically agriculture country. Our role becomes very important for looking after the health of the farmers. And as government declared fertilizer availability, seed availability, and insurance as essential services, our role became extremely important for continuing the economic activity along with safety of our farmers, our employees, and our cooperators. The important point is that how to India being a country which is very large population, where the density of population is high, the meaning of maintaining social distance was the real challenge. Number one. So, how to make people aware of the social distancing, for which large awareness campaign were started, and we have covered about 550,000 farmers and cooperators who have contributed, whom we have been able to tell them the importance of social distancing. We have provided them all kind of things. The masks have been provided, more than 1.5 million masks we have provided. We have provided them the sanitizer. Our cooperative societies, they're in far from area, in the area which are not even accessible. How to make them provide sanitizers, soaps, vitamin C tablets to increase their immunity. That program was taken up in a massive scale in IFFCO. Beside this, what we have observed is that for running the plants, you see, there are many work which are done manually, and there the social distancing and also protection for our people was important element where the scientific innovation had to be done. When you carry a 50 kg bag, it is very difficult to carry for a distance of 6. How do you provide a 6 feet um, or 2 meters gap? You can't just throw the bag and take care of it. So some kind of semi-automatic innovation were done to provide also social distancing and to take care of their health. So those are the areas where we have done lot of work. We have also seen that a lot of people when they migrate from one place to other, they need the support of the food. So food packets were provided to them were migrating from one place or other place. Or in our plant who are working, we have provided them to stay in the place because as per the government regulation, the people who are working in a continuous running plants like fertilizer plants, the workers cannot go back to their places. So they have to be confined at one place. All those arrangements were made for making them to confine the place and provide the services. We have also seen that our Prime Minister started a PM Care Fund where we provided about $3.75 million to to support the initiative of our Prime Minister. And today morning, yesterday, our Prime Minister has announced a $266 billion grant and stimulus package to the country for different section of societies. The details are coming up, and it so happened that your webinar and our finance minister's announcement was clashing. So I don't have the details right now with me, but I'm sure they'll provide some kind of support to our people. What we have to really look at it, that COVID-19 is a health emergency, is an economic emergency. It is not remain to a sector. It is not remaining to a particular set of people. It is a challenge for everyone. And the question is how to get that challenge to be tackled at our different levels. That is what needed. So I don't want to talk about what is happening, but as an organization and as cooperatives, what we can do. So when we have these kind of cooperatives which are far flung areas where reaching of the even the medical help is very, very remote possibility, how to make them realize that this can reach them also, and how to make them realize hand sanitation is important, about the taking care of the sanitary arrangements of the food arrangement, what kind of food is to be taken, how to get their immunity improved. So they are not the people who have a lot of money. So indigenous ways have to find to provide them immunity boosters. That arrangement was made by us, and we are happy to inform that so far in our institutions we have not had even one case of COVID, where we have 40 million members, 36,000 societies. We have plants, 11 plants in India. We have plants in India and outside India, including outside India. There had not been even one case of any COVID. So that is one which indicates how effectively we have been able to get the masses, what WHO has said, what government of India has said, what different governments have practiced, how to make that happen to a people who are not just aware what is this. They are not even aware what kind of this disease is. They've just heard this COVID, but they don't know what the COVID is really. So these are challenges which we have been successfully able to do. And I think as a cooperative, we are a service organization. We are one for all and all for one. That's the motto of cooperative. Cooperative does not recognize value of money. It recognizes value of people. And the value of people is what we have given most important aspect to it. And I'm just sharing it to you that for us, even the smallest person, we have the first taken care of him. We know that he doesn't have that kind of immunity which a person which is having little higher salary has. So first we have ensured that he gets that immunity level where his oxygen level is fine, where he has a resistance to be able to withstand this, develop the resistance to withstand this kind of disease, to follow the social distancing, to have the mask on him, and how to, those are the kind of people who have never used the mask in their life. So, how to make them realize that this is important for them. And now we feel the most important aspect is post COVID life. The post COVID life is life which is going to define how the economies of any country or any community will be there. And this is where the role of cooperatives, which is going to work with the smallest of small organizations to make them, handhold them, and to support them to be able to come out of it. This is what I think is most important post COVID. And we know we have to live with this disease for at least 2 years, because I don't think whatever people are saying that vaccine will come. I doubt that we will have any kind of vaccine which can be used on humans for next 2 years. So we have to keep in our mind that it is our constant effort and our constant hand holding together the worldwide support from each other, that we will be, God willing, successful. I just want to wish all of you good health, be safe, and remember, as a cooperative, we are together. We will be always standing together. Thank you very much for allowing me to speak.
Thank you, Dr. Awasthi.